If you are over 60 years old and you are still doing squats, whether that is in a gym, in a group fitness class, or just lowering yourself down in your living room because someone told you squats are the king of all exercises, I need you to stop what you are doing and listen to me very carefully, because what I am about to tell you could be the difference between walking comfortably for the rest of your life and ending up on my operating table with a knee that can never be fully repaired. I have been an orthopedic surgeon for over 30 years. I have opened up more knee joints than I can count. I have peered inside with arthroscopic cameras and seen things that would make you wince. And I can tell you exactly what I see when a patient over 60 comes to me after years of deep squatting. I see a meniscus that has been shredded, not torn in one dramatic moment, not ripped apart by some traumatic accident, but slowly, methodically ground down like a piece of soft rubber being dragged across coarse sandpaper, rep after rep, month after month, year after year. By the time these patients reach me, the damage is catastrophic and permanent. Now I know what you are thinking. You are thinking squats are supposed to be good for you. You have heard every trainer, every fitness influencer, every magazine article tell you that squats build strong legs and keep you functional as you age. And for a 25-year-old with healthy cartilage and a thick, hydrated meniscus, that advice is reasonable. But you are not 25 anymore. Your knee is not 25 anymore. The tissue inside your knee joint has been slowly losing its water content, its elasticity, and its ability to recover from stress for decades. What was once a plump, resilient shock absorber is now a thinner, drier, more fragile version of itself. And when you load that aging tissue with the extreme compressive and shearing forces of a deep squat, you are not building strength. You are accelerating destruction. Here is what I need you to understand right now, and this distinction could save your knees. There is a critical difference between muscular burn and joint grinding. Muscular burn, that sensation of fatigue you feel in your quadriceps or your glutes during exercise, that is healthy. That means muscle fibers are working, breaking down microscopically, and preparing to rebuild stronger. That is the goal of exercise. Joint grinding is something entirely different. It is a sensation of pressure, clicking, catching, or deep aching inside the knee joint itself, not in the muscles surrounding it, but within the joint. If you feel that during squats, that is not your muscles getting stronger. That is your meniscus being crushed between the two largest bones in your body. And unlike muscle, your meniscus has almost no blood supply in its inner two-thirds. It cannot heal, it cannot regenerate. Once it is gone forever. Let me take you inside your knee so you understand exactly why squats are so dangerous for anyone over 60. Your knee joint is the meeting point of three bones. Your femur, the thigh bone, sits on top of your tibia, the shin bone. In front of them, your patella, the kneecap, glides along a groove in the femur. Now, between the femur and the tibia, there are two crescent-shaped wedges of cartilage. These are your menisci. You have a medial meniscus on the inside of your knee and a lateral meniscus on the outside. Think of them as two rubbery, C-shaped gaskets that sit on top of your tibia like cushions on a chair. These menisci serve three critical functions. First, they are shock absorbers. Every time your foot strikes the ground, force travels up through your tibia into your knee. The menisci absorb and distribute that force across the entire surface of the joint, preventing it from concentrating on one small point. Second, they create a seal. Your knee joint is filled with synovial fluid, a slippery lubricant that nourishes the cartilage and allows smooth movement. The menisci help contain that fluid and create a suction seal that stabilizes the joint. Third, they act as spacers. They prevent the femur from sitting directly on the tibia, maintaining the gap that allows the joint to function without bone grinding against bone. Now here is the problem with squats. When you bend your knee past 90 degrees, something dramatic happens to the forces inside your joint. At full extension, standing straight, your meniscus handles roughly 1.5 times your body weight during walking. But as your knee bends past 90 degrees, which happens in every deep squat, the contact area between your femur and tibia shrinks dramatically. The same amount of force is now concentrated on a much smaller area of meniscal tissue. But it gets worse. At deep flexion angles, the forces acting on your knee shift from primarily compressive, meaning straight downward pressure, to include significant shear force, meaning a sliding, twisting force that drags the femur across the meniscus. Compressive force is what your meniscus was designed to handle. Shear force is what destroys it. It is like the difference between pressing your palm flat on a table versus dragging it sideways across sandpaper. A 2019 study published in the Journal of Biomechanics examined knee joint forces in adults over 55 during loaded squatting movements. Using implantable pressure sensors and motion analysis technology, researchers measured forces at various knee flexion angles. Their findings were alarming. At knee flexion angles beyond 90 degrees, shear forces on the medial meniscus increased by over 300% compared to a standing position. And in participants over 60 with documented meniscal thinning on MRI, the rate of new meniscal tears within 12 months of beginning a squat-based exercise program was nearly 4 times higher than in control groups who performed alternative lower body exercises. Let me tell you what happens when that meniscus finally gives way, because I have performed this surgery thousands of times. The procedure is called a meniscectomy. I insert a camera and small instruments through tiny incisions in your knee. I find the torn, ragged flaps of meniscal tissue that are catching, locking, and grinding inside your joint. And I trim them away. I remove them. I do not repair them, because in most patients over 60, the tissue is too degenerated to hold sutures. So I cut out the damaged portions and leave you with less meniscus than you started with. And here is the devastating truth about meniscectomy. Every study, every long-term follow-up, every piece of research we have shows the same thing. Removing meniscal tissue accelerates arthritis. You traded a torn meniscus for bone-on-bone contact. Within 5 to 10 years, many of my meniscectomy patients are back in my office discussing total knee replacement. That is, the road squats can put you on, and I do not want you on that road. So the question becomes, if squats are out, how do you build the leg strength you need to stay independent, to climb stairs, to get out of a chair, to live your life without fear of falling? The answer is 5 specific exercises that build every muscle the squat was supposed to build, but without ever forcing your knee past a safe flexion angle and without generating the shear forces that destroy your meniscus. We are going to start at number 5 and work our way to the single most important exercise for anyone over 60. Number 5, the glute bridge. Your quadriceps get all the attention when people talk about leg strength, but the real powerhouse of your lower body is behind you. Your gluteus maximus is the largest and most powerful muscle in the entire human body, and it is the primary driver of hip extension, the motion of pushing your hips forward and standing up straight. When your glutes are strong, they absorb a tremendous amount of the workload during standing, walking, and climbing, which means your knees do not have to work as hard. When your glutes are weak, and after years of sitting, they almost certainly are, your quadriceps and your knee joint are forced to compensate. Every step, every stair, every time you rise from a chair, your knee bears load it was never meant to carry alone. The glute bridge changes this by directly activating your posterior chain, your glutes and hamstrings, while keeping your knee at a safe, shallow flexion angle of approximately 45 degrees. There is virtually zero shear force on the meniscus during this exercise. Here is exactly how to set up. Lie flat on your back on a firm surface. A carpeted floor or a yoga mat works perfectly. Bend your knees so your feet are flat on the floor, approximately hip width apart. Your feet should be positioned so that when your hips are on the ground, you can almost touch your heels with your fingertips. If your feet are too far away, your hamstrings will cramp. If they are too close, you will push through your toes instead of your heels and miss the glute activation entirely. Place your arms at your sides with your palms pressing gently into the floor. Your head and shoulders should be relaxed against the ground. Your chin should be slightly tucked, not jutting upward. Now, before you lift anything, I need you to perform the most important step. Squeeze your glutes first. Do not push through your feet. Do not arch your lower back. Consciously clench your buttock muscles together as though you are trying to crack a walnut between them. Feel them contract. Feel them harden. Only after you have established that glute contraction should you allow your hips to rise off the floor. Press through your heels, not the balls of your feet, and drive your hips toward the ceiling until your body forms a perfectly straight line from your shoulders to your knees. Do not hyperextend. Your lower back should not be arched at the top. If anything, think about pulling your rib cage down slightly toward your pelvis to keep your core engaged and your spine neutral. Hold this top position for a full 3 seconds while maintaining that maximum glute squeeze. Then lower yourself slowly, taking a full 4 seconds to return your hips to the floor. Do not drop. Do not let gravity pull you down. Control every inch of the descent. This slow lowering phase is called the eccentric portion of the exercise, and research consistently shows that eccentric loading builds strength and tendon resilience more effectively than the lifting phase itself. How do you know if you are doing it right? You should feel the primary effort in your buttocks and the backs of your thighs, your hamstrings. If you feel it mainly in your lower back, your glutes are not firing, and your back is compensating, reset. Squeeze harder before lifting. If you feel it mainly in the fronts of your thighs, your feet are too close to your body. Slide them an inch farther away, perform 10 repetitions, rest for 30 seconds. Complete 3 total sets. When this becomes easy over the coming weeks, place a pillow between your knees and squeeze it throughout the movement, which recruits your inner thigh muscles and teaches your hip to stabilize in multiple planes. Number 4, the side-lying clamshell. Every time your foot hits the ground when you walk, your knee must track straight forward over your toes. When it deviates inward, when your knee collapses toward the midline of your body, surgeons and physical therapists call this knee valgus. This inward collapse creates a twisting force on the meniscus that is extraordinarily destructive. And the muscle responsible for preventing this collapse is not in your thigh. It is on the side of your hip. It is called the gluteus medius, and in most people over 60, it is profoundly weak. Your gluteus medius sits on the outer surface of your pelvis, beneath the more prominent gluteus maximus. Its primary job is to stabilize your pelvis when you stand on one leg, which you do with every single step you take. When this muscle is weak, your pelvis drops on the unsupported side, your knee dives inward, and your meniscus experiences rotational shear forces with every stride. A 2021 study in the Clinical Journal of Sports Medicine measured gluteus medius strength and knee valgus angles in 280 adults over 60 during single-leg standing tasks. Participants with the weakest gluteus medius measurements showed knee valgus angles 3 times greater than those with strong gluteus medius activation, and their rates of medial meniscal pathology on subsequent MRI were significantly elevated. The clamshell isolates this muscle with precision. Lie on your side on a comfortable surface with your knees bent at approximately 45 degrees and stacked directly on top of each other. Your hips must also be stacked vertically. Do not let your top hip roll backward, which is the single most common mistake people make. Rest your head on your bottom arm or a pillow. Place your top hand firmly on your top hip bone, the bony point you can feel on the front side of your pelvis. This hand is your monitoring device. It tells you immediately if your pelvis starts to rock during the movement. Keeping your feet glued together, raise your top knee toward the ceiling. The movement should come entirely from the rotation of your hip joint. Your pelvis must remain perfectly still. If you feel your top hip rolling backward under your monitoring hand, you have lifted your knee too high. Lower it slightly and find the range where you can move with complete pelvic control. Hold the top position for 2 full seconds, focusing intently on the contraction you feel in the side of your buttock, just behind the hip bone. Then lower your knee slowly back to the starting position. Perform 15 repetitions on one side, Then flip over and complete 15 on the other. Work up to 3 sets per side. When this becomes easy, add a light resistance loop around your thighs just above your knees. The constant tension from the band dramatically increases the challenge and accelerates strength gains. Number 3, the isometric wall sit, high angle only. When most people think of a wall sit, they picture someone with their thighs parallel to the floor, shaking and grimacing, knees bent to 90 degrees. That version of the wall sit is almost as bad as a squat for your meniscus. The version I prescribe is fundamentally different. You will position yourself so your knees are bent to only about 45 degrees, no deeper. At this high angle, the contact pressure in your knee joint is dramatically lower than at 90 degrees, yet your quadriceps are still working intensely. More importantly, because you are holding still, there is no sliding or grinding of the femur across the meniscus. This is called an isometric contraction, meaning the muscle is generating force without the joint moving, and it is one of the safest ways to build quad strength with a vulnerable meniscus. Stand with your back flat against a smooth wall. Walk your feet out about 18 inches from the wall, keeping them hip-width apart. Now slowly slide your back down the wall until your knees are bent to approximately 45 degrees. This is a very shallow sit. Your thighs should be far from parallel to the ground. Your knees must not extend past your toes. If they do, walk your feet farther from the wall. Press your entire back, from your shoulder blades to your tailbone, firmly against the wall. Your head should also rest against the wall. Look straight ahead. Now hold. Your quadriceps will begin to burn within 15 to 20 seconds. That burn is muscular fatigue, and it is exactly what we want. It means muscle fibers are activating and working under load without any shear force on your meniscus. Hold for 20 seconds initially, stand up, rest for 30 seconds, and repeat. Perform 5 holds. As your strength improves over the weeks, extend your hold time to 30 seconds, then 45, then 60. Do not progress by going deeper. Progress only by holding longer. If you feel any pain inside the knee joint itself, not in the muscles but in the joint, raise your position higher on the wall to reduce flexion angle further. Number 2, the seated leg extension with hold. On the front of your thigh, your quadriceps muscle group consists of 4 individual muscles. The one that matters most for your knee health is the vastus medialis oblique, commonly called the VMO. This is the teardrop-shaped muscle on the inner side of your knee, just above the kneecap. The VMO is the primary muscle responsible for tracking your patella correctly through its groove in the femur. When the VMO is weak, the kneecap drifts laterally, creating uneven pressure on the joint surfaces and contributing to anterior knee pain. Sit in a sturdy chair with your back straight and your feet flat on the floor. Your thighs should be fully supported on the seat. Slowly straighten your right leg until it is fully extended in front of you, parallel to the floor. Do not kick it out. Take a full 3 seconds to straighten it. As you reach full extension, rotate your foot slightly outward so your toes point to the 1 o'clock position. This slight external rotation biases the contraction toward the VMO. Now hold your leg at full extension for 5 seconds. Focus intently on the muscle just above and to the inside of your kneecap. You should feel it hardened like a rock. Then lower your leg slowly, taking 4 full seconds to return your foot to the floor. Do not drop it. Perform 12 repetitions on each leg. Complete 3 sets. If this is too easy, add a light ankle weight of 1 or 2 pounds to begin. The key to this exercise is the hold at the top and the slow lowering phase, not heavy weight. Number 1, the high chair sit to stand. This is the exercise that replaces the squat in your life. It trains the exact movement pattern, standing up and sitting down, that you need for daily independence. But it does so with a critical modification that protects your meniscus. By using a chair that is higher than standard height, you limit your knee flexion to well under 90 degrees. And by emphasizing the lowering phase, what we call eccentric control, you build the strength needed to prevent the one thing that terrifies every geriatric specialist I know, the uncontrolled crash into a chair that precedes the fall that breaks a hip. Find a sturdy chair or place a firm cushion on your existing chair to raise the seat height. When you sit on it, your knees should be bent to no more than about 70 degrees. Your feet should be flat on the floor, hip width apart, positioned so your knees stay behind or directly above your toes. Place your hands across your chest, not on the armrests, not pushing off your thighs. Here is the movement. To stand, lean your torso slightly forward to shift your weight over your feet, then drive through your heels and rise to full standing. Squeeze your glutes at the top. That is the easy part. The important part is sitting back down. Do not crash, do not plop. Take a full 4 to 5 seconds to lower yourself back to the chair. Imagine you are trying to sit down on a carton of eggs without breaking them. Your quadriceps, your glutes, and your hamstrings are all working during this slow descent, controlling the speed of your body against gravity. This eccentric phase is where real functional strength is built. It teaches your nervous system to manage your body weight smoothly and safely through the exact range of motion you use dozens of times every day. How do you know you are doing it right? If you can hover your seat 1 inch above the chair cushion and hold it for 2 seconds before gently making contact, your eccentric control is excellent. If you touch down with a thud, no matter how hard you try to control it, your muscles are not yet strong enough to manage the descent, and this exercise is exactly what you need. Perform 10 repetitions. Rest for 30 seconds. Complete 3 sets. Over time, lower the chair height by 1 inch at a time as your strength improves, always stopping well short of 90 degrees of knee flexion. Your meniscus cannot regenerate. You do not grow new cartilage. The damage you prevent today is the surgery you avoid tomorrow and the knee replacement you may never need. Start with the glute bridge tonight. Add 1 exercise each day this week. Be patient with your body. Your knees did not become vulnerable overnight, and they will not become bulletproof overnight either, but they will become stronger. They will become more stable. And you will stand up from a chair, walk down a flight of stairs, and move through your daily life with a confidence you may have thought was behind you. Now I want to hear from you. Which of these 5 exercises are you going to start with today? Have you felt that grinding or catching sensation in your knee during squats? Tell me about it in the comments below. I read every single one. Thanks for watching.